My name is Jessica Manson. I'm a rheumatology consultant and the HLH service lead at University College Hospital in London. So I lead a team of rheumatologists, hematologists, infectious disease doctors. We have critical care input, neurology, and more recently solid organ cancer, because we're seeing increasing problems with iotox-associated HLH. So we have an approach where we will input to patients in our own trust, so in our own hospital in UCLH, but we also provide advice through a national advisory panel system for patients anywhere within the UK. Patients can be referred to us using our website. So we have a website for the UCLH HLH service, and there are referral information and so forth is on there. And then the lead consultant looking after that patient will come and present the case to this cross-specialty group of physicians. And then we help advise on the management of whether we think it's HLH or not. And in our experience, about 90% of patients that are presented do have HLH, and how we should manage that HLH, and then what we think the cause of the HLH is. So we know that if we don't also treat the driver or the trigger, then the HLH keep coming back and the outcome is bad. The vast majority of doctors who come, actually, they kind of know what's going on, and they're there partly to get reassurance that things are going in the right direction. But also you might not be in a hospital that has ready access to some of the specialists that we provide. So I think the UK National Health System lends itself very well to this collaborative sort of working, and is nicely for us becoming slightly the envy of some bits of the world. So we have this National Health Service based online guideline called GIRFT, Getting It Right First Time, that amazingly gets 1,000 hits a month, which is a lot for a rare disease. And I understand from my colleagues in Europe and the States, for instance, that they're beginning to use it more and more there too. So no, the approach is considered to be correct, if you see what I mean, and advocated internationally. The NHS lends itself to that kind of working, I think. Just a practical thing, that if you're interested in learning about HLH, we have people who come to the national advisory panels, 6 a month at UCLH, 2 a month in Sheffield, that they come just to learn. So often colleagues who've come to present a patient often say, gosh, you know what, that was a really interesting meeting. I learned a lot and I'd like to come each week, and that's completely fine. And we also have a second organisation called HIHASC for Hyperformation and HLH, a cross-specialty collaboration, free to join, just email me. And we offer every couple of months teams-based learning opportunities. We have a research network. We have we are linked with patient support charities too.